Well, a warm welcome to today's talk, Monday the 25th of July now. I want to talk today about a couple of things that are concerning me, partly pandemic related and partly not. And the first one is the disruption to childhood vaccinations. Now, this is not talking about COVID vaccination. This is all the other routine childhood vaccinations that have been so essential in preventing the mass infant mortality and young person mortality that we used to see before these interventions came along. We'll talk about that first of all, and then I'll see how time goes. But I might talk a bit about the death rate in New Zealand, which is concerning for various reasons. Anyway, let's dive straight into this stuff on childhood vaccinations first of all. Now, this is from the World Health Organization, and it's the effect of the COVID pandemic on other vaccinations, and it really is quite profound. So this is kind of the headline from the WHO. Pandemic fuels largest continues backsliding vaccination in 3 decades, 30 years. And this is basically true. The figures are bearing this out. Global vaccination coverage continued to decline in 2020. Now, I suppose this could have been anticipated in 2020. But then 2021, 2010, 22, you'd think we'd be getting our act together a bit now, especially, thankfully, as Africa was spared most of the ravages of the pandemic. But we'll see that there's vaccine difficulties in quite a few other areas of the world as well. And this is going to have huge implications for the health of children. It could well be that the consequences of the pandemic, in terms of what we might call collateral or ongoing damage, are way greater than the damage from the COVID pandemic itself. And we've looked at some of the reasons for that. This one's on childhood vaccinations. Now, this data is from WHO and the United Nations International Children Emergency Fund, UNICEF. So, diphtheria, tetanus, pertussis, 3 bacterial infections, of course. Pertussis is sometimes called the 100-day cough or whooping cough. Bacterial infections. The thing about this is it's quite often used as a proxy to look at how all the other vaccinations are going. So if the numbers of DPT are up or down, probably other vaccines or other vaccines are going to follow roughly in line with that. So what we see is down 5% between 2019 and 2021. Now, 5% might not sound a lot, but this is 25 million children missed out on one or more of the diphtheria, tetanus, pertussis doses in 2021, and 18 million are left with no coverage at all. And they are very prone to these often childhood diseases. So 18 million with no doses globally. This is huge numbers of children. Now, India, Nigeria, Indonesia, Ethiopia, Philippines, Myanmar, Mozambique were mentioned particularly in this WHO report, but other countries as well. And the report says these are devastating but preventable diseases. And they are. I've seen all of these diseases. They are deadly diseases very often and certainly make children remarkably sick or very serious, and indeed can affect older age groups as well. But they are pretty well, not entirely vaccine preventable, but pretty well vaccine preventable. Now, the factors. Why are the vaccine rates down so much? Children living in conflict and fragile settings. That's basically security implications, which unfortunately we know all too well are ubiquitous in the modern world. Increasing misinformation is another one. This is concerning. There's a lot of misinformation out there. Particular groups are saying that particular vaccines have particular effects. So we saw this in Pakistan, for example, where particular religious groups were saying that this is a plot by Western countries to cause mass sterility in our population, and other ridiculous things like that. Some are ridiculous, some aren't so ridiculous, but one way or the other, there's a lot of misinformation out there, which is a real tragedy when we're talking about lives, and especially children's lives. Here we're talking about very often lives under the age of 5, whereas the pandemic we were talking mostly about older lives. All lives are important, but to lose a child at the age of 2, you're losing potentially 80 or 90 years of higher quality life. It really is the greatest tragedy that can befall humanity, really, the death of children. Increasing misinformation, right? Supply chain issues, COVID-19 related. Have many countries overreacted to the COVID situation at the detriment of other things? So service and chain supply distribution issues, resource diversion, health resources being diverted to be quite honest, sometimes quite expensive COVID vaccinations, rather than these ones which might be more efficacious to younger people particularly. Containment measures from the pandemic, limited access to healthcare. Catherine Russell, UNICEF, this is a red alert for child health. I agree. We are witnessing the largest sustained drop in childhood immunisation in a generation. Clearly, the figures speak for themselves. Nothing to argue with here. The consequence were measured in lives, absolutely. Tragically, I completely agree. We need immunisation catch-ups for the missing millions, or we will inevitably witness more outbreaks. Absolutely right. More sick children and greater pressure on already strained health systems. And of course, many children will simply die. So we agree completely with these statements. Now, they give another example here of human papillomavirus. This is the one that causes nearly all cases of cervical carcinoma. From memory, the vaccine came in for this, I think it was about 15 years ago now. And although it's been authorised for 15 years, the global coverage in girls is 15%. And when those girls become women, become sexually active, they will be greatly protected against cervical cancer. Again, a horrible disease. I've seen many people, unfortunately, die from cervical cancer. If we can prevent that, that is well worth doing, but it's simply not being done to any reasonable extent. Global coverage for the first dose was 15%. 15%. So most girls not getting this coverage. A backdrop of rapidly rising rates of acute and severe malnutrition. Now, we have covered this on this programme before. The difficulty in global food supply, the Ukraine situation, which hopefully is being sorted out yet, but we still await for supplies. Global food supply shortages, cost of living crisis, increase in prices of food. Basically, starvation is becoming a real phenomenon. And you might not see it in huge outbreaks of famine like we did in maybe the 80s. But it's insidious and it's there all the time, and it attacks the weakest people in society. Acute malnutrition, particularly, of course, children. The weakened immune systems, malnutrition, of course, weakens the immune system. Plus the vaccination crisis, then the combination of both is bad. A child survival crisis, a direct quote from the United Nations groupings. Now, first dose of measles coverage dropped to 81% in 2021. 24.7 children missed out on the first dose of measles vaccine. Measles has been a chronic cause of death in children for, well, as far as we know, for millennia. And it was getting under control, but now it's slipping again. Terrible viral infection, very difficult to treat. The treatment is really only supportive when children get it. And it's a life-threatening condition. Let's see. So basically 25 million children missed out on a first dose. Then that's increased from 2019. So 2021, things not improved after the 2020, which was the main pandemic year. 5.3 million more. The number of children not getting vaccinated is increasing. This is the problem. January and February 2022, 17,338 cases officially reported. And of course, we know from looking at COVID that the number that are officially documented are only a fraction of the real number of cases. And that's just in 2 months, the global figure for those 2 months. Compared to January 2021, so great increase between 2021 and 2022, only 9,665 cases in 2021. So we're seeing already the effect of the reduced vaccination-induced immunity in measles. That is now happening. And it's so sad because this is nearly all preventable. Nearly all preventable. 2018, last year of full figures from the WHO, 140,000 measles deaths, mostly among children under the age of 5. This is quite an awful situation, and basically the world needs to do whatever it needs to do and get these children, particularly in poor and vulnerable areas, vaccinated. We sometimes talk about a postcode lottery in the UK, and we have that. What treatment you get depends on where you live. I just don't see why your chances of making your 5th birthday should depend on where you were born. We need to get these health situations, the vaccination and the malnutrition. These are very simple things. If children are hungry, feed them. If they're at risk of disease, vaccinate them. Not COVID vaccinations we're talking about all the other childhood vaccinations. This is not high-tech medicine by any means. So I think we're probably nearly finished there. Should we do New Zealand today? Let's do New Zealand briefly. So New Zealand. Now, this is disturbing to me. This is disturbing to me. Let me show you a couple of graphics. So New Zealand newly daily confirmed deaths per million. Fairly accurate data. New Zealand is way higher than Australia. Now, I would have thought New Zealand should probably be comparable with Australia. The UK, of course, is higher because we've got this, a bit of a BA5 surge at the moment. The United States still, thankfully, quite low. And when we look at the figures on that, we see that New Zealand is quite a bit higher than we would expect, compared to Australia, for example. Now, of course, I don't know in detail why this is, but I'm going to read you a comment from Jay. Jay, first of all, thank you for sharing your pain with us. It's a noble thing to do. But let's look at your communication now. I'll read this out. My father died in New Zealand 2 weeks ago with COVID because they euthanized him. Now, I can't tell you whether this is right, wrong, or indifferent. I can just relate it as Jay's experience. So that's all we're doing. But the fact that Jay would have this perception disturbs me, even if it's just a perception. If it's reality, it disturbs me even more. But as I say, I can't adjudicate on that. But we'll carry on with her experience. The death rates are higher because they are killing the elderly in hospital. We knew this would happen after the euthanasia law was legalised. Again, this is Jay's views. If you're in New Zealand, do let me know what you feel the situation is. The number of deaths is insane right now. The cemeteries are at capacity. When we buried Dad, there were 3 other funerals at the same time. Even undertakers, gravediggers admit things are crazy right now. So very sad to hear this about the New Zealand situation. Now, this is Jay's, again, I can't verify this. This is Jay's experience, her perception. They put Dad in an isolation for 11 days where I was banned from seeing him. Now, Jay, I can relate to this because my dad was sick. my dad was sick in the first COVID wave and couldn't go and see him. It's difficult, very difficult. So I can relate to that. Very, very difficult situation. They put Dad in isolation for 11 days where I was banned from seeing him. He was in a locked room and neglected and starved. Is Jay's perception. If it's reality, it's even more disturbing. When we came out, he'd lost 11 kilograms in 11 days and was so weak, caught pneumonia from hospital, then got worse. Now, this isn't surprising at all. Immobility and illness very often leads to pneumonia. So that's a well-recognised complication of illness and immobility, of course. So that makes perfect sense, unfortunately. Blood clots in the lungs, which were blamed on COVID, but when he was bedridden, he got no one to walk him. Now, again, this is a well-recognised complication of immobility. You can get deep venous thrombosis resulting in pulmonary embolism. Everyone learns about this. We learn to prevent this, but it sounds like this may have happened rather than COVID-induced blood clots. We wouldn't know without a pathology report on that to be accurate, I don't think, or at least some investigation reports, which clearly we don't have. this is Jay's perception of this. So they didn't get him to walk. They were so short of staff due to mandates that they left him with a catheter for just over a week so they didn't have to toilet him. Now, I taught the process of catheterization over a couple of decades more, and of course we talk about the indications, and an indication for catheterization, there's quite a few of them, but one that is not an indication is to make it more convenient so you don't have to toilet someone because of the risks and discomfort associated with catheterization. Well, downright pain associated with catheterization. And the risk of infection is, well, with the catheter you are going to get some type of infection. It's inevitable, even if it's only a urethritis, inflammation of the urethra, to get some infection. So again, if that was done, that would again concern me. It's just not what nursing and medicine is about. So they're so short-staffed due to mandates. He went in healthy and came out dead. When they got him so weak, they just gave him midazolam, which is a euthanasia drug, and finished him off. I'm opening an inquiry because this also happened to my friend's mother too. Now, again, I can't say how accurate this is or not, but the fact that this is Jay's perception is deeply, deeply disturbing. If it represents reality, it really is a big question that we would have. Let's just carry on now. Now, what I did was I've just looked around at this a couple of things. Now, this is for the New Zealand Nurses Organisation. Check out the reference there. Now, this is a direct quote from their site. This is from one of their surveys. 99% of respondents said the system was either in crisis or already beyond crisis. So do let me know what's going on in New Zealand. And I did check on the End of Life Choices Act 2019 New Zealand, a proud country of New Zealand, which of course we have very close links with traditionally in the UK. 7th of November 2021, people with terminal illness who met specific criteria can ask for help to end life is kind of the wording that I'm getting from my reading on this topic. Now, in the UK, we have, and I've often used not for resuscitation orders. So someone who's severely ill, again, we did this for my dad lately, he was severely ill prior to his death. We decided it wouldn't be appropriate to have the crash team and all the defibrillators and all the dramatic resuscitation that would be indicated in a younger person without comorbidities. That's quite common to decide that, but in my mind, there's all the difference in the world between not carrying out a sophisticated intervention, which may cause a lot of distress to the individual, and actively intervening. There's a big difference there. So not to be confused with the not for resuscitation orders that we have in the UK, not at all. My experience of not for resuscitation orders has been good, that they've been the ones I've been involved in, I feel, have been well done with informed consent from all those concerned. The administration of an assisted dying medication. This is a direct quote from the UK government's, not the UK government, sorry, I hasten to correct myself, the New Zealand government site. Wrapped up in very nice language, it has to be said. The administration of assisted dying medication can only be done by a medical practitioner or nurse practitioner, so actually giving medication to end someone's life, such as midazolam. So euthanasia is when someone would actually intervene to bring about the end of life, as opposed to assisted suicide, where that would be facilitated. So I just find this pretty concerning. So our severe, extreme condolences for your loss, Jay. Thank you for sharing it, and do let me know if you're in New Zealand what's going on. So, to summarise, the pandemic's causing problems in parts of the world still, but I still believe that the adverse effects generated by our response to the pandemic are probably going to result in many more deaths. And these may carry on for some years into the future. which of course is tragic. And don't like to leave on such a downcast note. It's up to us to improve the situation. So thank you for watching.